Today we're going to review the 2019 LIS MSP updates and dual eligible. As you know, LIS stands for Low Income Subsidy, and MSP for Medicare Savings Plan. What is a low income subsidy, better known as LIS, oftentimes called extra help? You apply through the Social Security Administration. It's for people with the lowest income and resources. They may pay no premiums or deductibles and small or no copayments. Those with slightly higher incomes and resources pay reduced deductibles and little or more out of pocket. They never go into the coverage gap for people who qualify for LIS. Qualifying for extra help. You automatically qualify for extra help if you have full Medicaid coverage, receive SSI, which is supplemental security income, if you have a Medicare savings plan, a QMB, SLMB, or QI1. All others must apply for LIS or extra help through the Social Security Administration online at www.socialsecurity.gov. They can apply by calling the Social Security Administration, or they can ask, and when they call, they can ask for an extra help application or applying for the Medicare prescription drugs plan. You can also apply by contacting your local SHIP office. The form which they can ask for when calling is the SSA 1020. The 2019 income and resource limits. The income for below 150% of the federal poverty level. The income amount for an individual is $1,581 per month. $2,134 per month for a married couple, and that is based on family size. They can have resources up to $1,390 for an individual and $28,720 for a married couple. This does include $1,500 per person for funeral or burial expenses, and it counts savings and investment, and it does not count the home in which the person or the married couple lives in.
Password. That didn't ask for password.
Please remember to mute yourself.
Colleen Hughes.
Thank you for joining us, Carlene.
Thank you.
The premiums for extra help. Premiums are reduced by $31.40 in plans that participate, with a reduced copayment of $8.50 for brand names, $3.40 for generics. No drug plan deductibles. You are exempt from the coverage gap or going into the donut hole. Partial extra help may also be available for those who at 25%, 50%, or at 75%. Full extra help is equivalent to below 135% of the federal poverty level. 75% extra help is equivalent to 135 to 140% of the federal poverty level. 50% extra help is equivalent to 140 to 145% of the federal poverty level, and 25% extra help is equivalent to 140 to 150% of the federal poverty level. Partial extra help benefits. The premiums are reduced by $31.40 for 100%, reduced by $23.55 for 75%, reduced by $15.70 for 50%, and reduced by $7.85 for 25%. the maximum of 15% cost of your drugs and a maximum $85 for the Part B deductible. Medicare Savings Plans Program. Your QMB is Qualified Medicare Beneficiary. SLMB, Specified Low-Income Medicare Beneficiary. QI1 is Qualified Individuals, and the Qualified Disabled and Working Individual. QMB, Income and Resource Limits. Income below 100% of the federal poverty level. The income is $1,061 per month for an individual, or $1,430 per month for a married couple based on family size. Resources up to $9,230 for an individual, or up to $14,600 for a married couple. This includes the $1,500 per person for burial and or funeral expenses, and counts savings and investments, and does not count the home in which you live in. QMB pays the 20% copay for Medicare Part A and B, the deductibles for Medicare Part A and B, the Medicare Part B premium, the Medicare Part D premium up to the state's benchmark, which for 2019 is $31.40. Extra help copays do apply. SLMB, Income and Resource Limits. Income is between 101 to 120% of the federal poverty level. The income is $1,269 per month for an individual, or $1,711 per month for a married couple, which is based on family size once again. Resources up to $9,230 for individual, or $14,600 for married couple. Once again, it does include the $1,500 for funeral and burial expenses. It also includes the counts towards the savings and investments of the family, and does not count the home in which the family is living in. For QI1, that's 121% to 135% of the federal poverty level. Income of $1,426 per month for an individual or single person, $1,923 for a married couple. Resources of $9,230 for an individual, and $4,600 for a married couple. $1,500 is included for funeral and or burial expenses, and does count savings and investments, but not the home that the person or family is living in. SLMB and QI1 will pay for Medicare Part B premiums, Medicare Part D premium up to the state benchmark for 2019, which is $31.40. SLMB and QI1 do not pay the 20% copay for Medicare Part A and B, and does not pay the deductibles for Medicare Part A and B. The qualified disabled working individual income is at or below 200% of the federal poverty level. The income for an individual is $4,249 per month for a single person, and $5,722 per month for a married couple. The resources for QDWI is $4,000 for an individual, or $6,000 for a married couple. Counts savings and investment, but does not count the home that you are living in. QDWI pays Medicare Part A premium. QDWI does not pay Part B premium. The 20% copay for Medicare Part A or B the deductibles for Medicare Part A or B. For additional resources, we're going to review additional resources for dual eligible. The definition of dual eligible. Dual eligible means you have both Medicare and Medicaid. Medicare is having both Part A and or B. Medicaid is Medicaid or QMB. Major Medicaid eligibility categories for the state of Tennessee are children, pregnant women, parents or caregiver relatives, newborns, medically needy, those having SSI income, institutionalized individuals, women with breast or cervical cancer, TennCare standards, or Medicare savings plan. SSI is determined by the Social Security Administration. If you qualify for SSI, you will not qualify for a Medicare savings plan. You will not get a QMB card, but use your managed care organization, your MCO card, whether it's Blue Care, United Healthcare, or Amerigroup. You may stay in the MCO providers. You must stay within the MCO providers network for your 20% co-insurance to pay. Dual eligible cost depends on the category and network restrictions. A dual eligible may pay nothing, may pay Part B premium, or it may pay co-insurance and co-payments. A dual eligible will pay nothing if they qualify for QMB, they qualify for the SSI Medicaid category, and stay in that managed care providers network. They may pay nothing if they qualify for another category of Medicaid and have a Medicare savings program to pay their Medicaid Part B premium. Dual eligibles who pay Part B premiums on original Medicare, some categories of Medicaid do not cover the Part B premium cost. Income and resource limits for each category differ. You may qualify for a category of Medicaid, but your income is over the limits for a Medicare savings program. Dual eligibles who pay co-insurance on original Medicare. If you qualify for some categories of Medicaid, you may be responsible or have co-insurance. For one, if you qualify for a category of Medicaid and go outside of your managed care organization's network. This is not the case if you qualify for a category of Medicaid and have QMB. Or if you qualify for SSI Medicaid and go outside of the managed care organization's network. A dual eligible will pay nothing if they qualify for QMB and stay in their managed care plan or stay within the network. They qualify for the SSI Medicaid category and they stay in the managed cares and the MA's plan of providers. They qualify for a category of Medicaid and have a Medicare savings program to pay their Medicare Part B premium, and they stay within that managed care organization's plan or network of doctors. Some categories of Medicaid do not cover Part B premium costs due to income and resource limits. For each category, they differ. You may qualify for a category of Medicaid, but your income is over the limit for a Medicare savings program. Dual eligibles who pay co-insurance or Medicare Advantage plans. If you qualify for some categories of Medicaid, you may be responsible or have a co-insurance if you qualify for a category of Medicaid and go outside of your managed care and or your plan's network of doctors. This is not the case if you qualify for a category of Medicaid and have QMB and stay in the plan's network. If you qualify for SSI Medicaid and you go outside of the MCO and or managed care plan network of doctors.
Hey, Vivian, we got a question into the chat box.
Okay.
The question is, what is the definition of dual eligible?
Dual eligible is that individual that has both Medicare along with Medicaid or TennCare. You want to elaborate, Sydney?
Nope. That's it.
A dual eligible and drug costs. A dual eligible will get assistance with paying their drug costs if they qualify for any category of Medicaid. The drug benefits with dual eligibles is $3.80 or $1.25 drug copay. They have no deductible. They will not go into the donut hole, and premiums are reduced by the benchmark of $31.40 if that plan participates. Please remember to complete the evaluations. Are there any questions?
Nothing has come into the chat box. I do want to, if it's okay, Vivian, do want to elaborate a little bit on the Medicare Advantage plan side of things, if that's okay.
Sure.
So I do want to remind everyone, well, first of all, hey, I'm back. Told you couldn't get rid of me. So anytime you deal with someone who is enrolled into a Medicare Advantage plan, the Medicare Advantage plan's network trumps any other network. So if the beneficiary goes outside of the Medicare Advantage plan's network, they're most likely going to be responsible for 100% if they're enrolled in a HMO, or they could be as high as the 40 or 50% if they're in a PPO. Medicaid will not cover any copays or anything if the Medicare Advantage plan does not pay first. Same thing with original Medicare. If the claim is denied, Medicaid is not going to cover that. Another question came in, is there any kind of decision tree, quote unquote, for individual qualification?
Decision tree as in other than the income guidelines and income and resource guidelines? Well, there are the income and resource guidelines along with the categories of Medicaid.
We're getting some feedback, and I can't tell who it's from. Oh, got it.
Okay, because I was about to say I can't like everything.
Let's see. Justin Martin has his hand raised. Justin, I'm going to unmute you. You are good to go. What's your question?
Hi, Sydney. This is actually Helen in with Justin. But why is there a difference between the drug copays that were showing on that previous screen for dual eligibles versus the drug copays that they get under the LIS and the Medicare savings programs?
Okay. Vivian, I'll let you take this one.
Okay, I'm sorry, I'm kind of...
well, I can answer it if you want.
Okay.
So there's different levels of copays depending on how much assistance you qualify for. So LIS, low-income subsidy, and the Medicare savings programs, QMB, SLMB, QI1, all of those are at, I believe it's a Tier 1 assistance, or maybe it's Tier 2. I can't remember the exact tiers. But their level is what Vivian's showing on the screen at the $8.50 for brand names and the $3.40 for generics. Anyone who qualifies for full Medicaid from any state, in our state it's called TennCare, or it's through the Bureau of TennCare, but the actual categories are considered Medicaid. And anyone who qualifies for one of those categories that Vivian mentioned kind of earlier, the breast and cervical cancer, family caretaker relative, all those, they're at the highest tier of assistance, and those are the ones that go down to the, I don't remember what you had on the slides, the $1.25 for generics and, nope, keep going.
Yeah.
Let's see, the $1.25
to $3.
Yeah, that's what I've
and the
seen.
$3.80.
Yeah,
think there
okay. I think her questions kind of threw me off, but once, the drug cost.
The three, you're going the wrong way for the lower ones. Keep going down to your Medicaid categories. Keep going, keep going, keep going. Keep going. Oh, go back one. There we go. Yeah, the 380 and 125 is if you qualify, if you're considered dual eligible, meaning you have Medicare and Medicaid, you're at the highest tier of assistance, meaning you have the, it looks like it's level 2 based on our notes. So full dual is a level 2 assistance, and level 1 is the full extra help or partial assistance. The $3.40 and $8.50 is level 1. Does that help answer your question?
Yes, that I've seen that, or Jennifer and I especially see that with like people who call in already having Medicaid for choices. We see when we ask how much they pay for medicine, it's typically within that range, so that makes sense.
Yeah, and one other thing I did want to point out, and sorry Vivian, I keep talking, but when Vivian listed those categories of Medicaid, if you could go back to that slide, Vivian, real quick, the keep going, almost there. There, this one. Oop. Oop. Go back. One more. There you go. Stop. Oop. Up. Up one more. There you go. Stop right there. So all of these categories, we don't go into applying for Medicaid when it comes to SHIP. You guys, our focus is the Medicare Savings Program. What Justin just mentioned with the Choices Program, that's the long-term care services and support. That's specific to the local area agency on aging and disability. That's a category of Medicaid. That category in particular has a much higher income income and resource guideline than a Medicare Savings Program does. So it's very possible that someone that Justin and Jennifer work with who qualify for the Choices Program are not going to get their Medicare Part B premium paid for because they are over the QMB, SLMB, or QI1 limit. So I know when I was with SHIP, I got a lot of questions, and I know Vivian's getting a lot of questions. My person has Medicaid. Why isn't the state paying their Part B premium? Well, they could be a pregnant woman. They could be a parent or caretaker relative. They could be medically needy. They could be any one of those categories listed on the screen and be eligible for Medicaid but have a higher income and still be responsible for that Medicare Part B premium.
Okay, I'm sorry, Sydney, I actually didn't know that. So just to clarify, so even if someone has an MCO, if they are over that income limit, they may not be getting that premium paid for.
Correct. So, Justin, remind me, you know this better than I do. What is the maximum income for the Choices Program? Do you know off the top of your head?
It's $2,250 before any deductions.
Perfect. So $2,250 is way higher than the QMB, SLMB, or QI1 limits that Vivian talked about a little while ago, right? So they're going to get their 20% paid for having Medicaid, but they're still going to be responsible for that Medicare Part B premium because they're over that income limit.
Okay, that's really good to know. Thank you.
You're welcome. We did have a couple questions come in, Vivian, so I'm going to ask these to you.
Okay.
Can you discuss what happens for individuals that are dual eligible and are traveling outside their MA network and experience an emergency needing treatment?
Emergency treatments are covered. The issue comes in with a hospitalization, that's where, but emergencies are covered. Now, a hospital stay or anything that will cause them, even after hospital, to may not be able to travel and have to stay there for therapies or things like that, if they're outside of that network, that's where the questions come into play when you're dealing with the Advantage plan. But emergency room visits are covered under Advantage plan.
Another way to kind of phrase that, Vivian is absolutely correct. Another way to kind of think of it is when the person is no longer considered emergent and they're considered stable, or they're no longer under that emergency status, that's when they need to get to an in-network provider for their coverage to be in effect. Let's see. Clarification to the previous question about the decision tree. So she says, I mean, you qualify for one program but not another. How do you know which program benefits a person can qualify for?
Well, one determination is the incomes and resources. However, when you're looking, I guess, when we look at, I guess, the categories, we definitely say that the Social Security Administration determines, I guess, the categories. And we just, I don't know, Sydney, because there are different categories, and it's determined by the Social Security Administration which category that person qualifies for, especially, say, for women with breast cancer or cervical cancer. That is something, that Medicaid category is determined initially by the Social Security Administration.
Actually, Vivian, that determination is made by the Bureau of TennCare.
TennCare, yeah.
Yeah. Social Security only determines low-income subsidy. That's the only one. Another way, I think I might know what this volunteer is getting at. So, for example, if you qualify for a Medicare savings program, and that's either QMB, SLMB, or QI1, if you qualify for one of those three categories, you automatically qualify for the low-income subsidy program. That's part of the included benefit of a Medicare savings program. If you qualify for one of the categories of Medicaid listed on the screen, you automatically qualify for the low-income subsidy program because you have Medicaid. And you may even get those lower reduced copays we talked about earlier, the $3.80 for a brand name and $1.25 for a generic, because you have that Medicaid category. So that's another way, besides looking at the income and resource guidelines. There are some people who automatically qualify for some of the low-income subsidy. Another question came in, can we print off slides?
Yes, once we'll email them to you after the presentation. Oh, yeah, but I emailed them to you earlier, before, this morning. They were emailed to everyone that registered prior to this morning. We had a few people that registered this morning. But I've already sent them out for everyone that registered yesterday and previously.
Okay. And you'll also include them in the follow-up email?
Yes.
Okay. Another question. So the 5% never enters this drug cost regular donut hole as greater of, I think the text might have gotten cut off, but I'm pretty sure when this volunteer is referring to the 5%, they mean the catastrophic coverage through the donut hole.
Oh, people that qualify for extra help?
Right.
No, they never enter into the donut hole. Which means they never enter into catastrophic. So.
Another question came in, are you all going to send the extra help soft copies? I assume that means the extra help brochures. I think that's what that means.
Okay, we have not gotten the official numbers from Tennessee yet. So when we do get those, we will get them out.
Do you also want to mention that the brochure is being updated?
It is currently in the process of being approved and updated, and we're waiting on the powers that be to give us permission to release that.
Okay. Another question is, to clarify, does that mean someone who has Medicaid and MCO is over the LIS income limit still receive LIS extra help?
No, if they have, okay, read the question again, Cindy.
If a person qualifies for Medicaid, and they're over the limits for low-income subsidy, do they get the extra help benefit? The answer to that is actually yes. The income for the extra help for the prescription drugs, as long as you qualify for the Medicaid category, you still get your medications at a reduced cost. Even if you qualify, say, for the Long-Term Care Services and Supports Choices program, and you make $2,500 or whatever the maximum is, because you qualify for one of those Medicaid categories listed here on the screen, you automatically get a discount on your medication. The Part B premium being paid is the determining factor of the income, not the assistance to pay for the medication. Sorry, I'm talking too much again. I don't have any other questions that have come into the chat box. I see Barbara Whiteman, you have your hand raised. I'm not sure if you have a question, but I'm going to unmute your line to see if you have anything you want to say. Barbara Whiteman, your line's open if you have a question. Okay, that might have been a hand raised just so she let us know that she's on the webinar. All right, I don't see any. Oh, well, Justin, your hand was raised. Do you still have a question, Justin? Nope, he lowered his hand. All righty. So I do have everyone muted due to background noise, so if you have any questions, feel free to raise your hand or type them into the chat box for us. But I don't see any other questions, Vivian.
Okay. So before we end this, is there anyone who didn't type their name into the chat box? We need to make sure that you get credit. Well, we want to thank everyone for attending today. And as always, if you think of some additional questions after the fact, feel free to email them to me. I'll be more than happy to try to get the answer if I don't know it. And we will get a copy of the presentation out to you along with the other attachments. And I wish everybody a great and wonderful Thursday. Enjoy your second day of spring. Thank you.
Vivian, don't exit out of anything yet, please.
Okay.
Hello. I hear you.
Yes.
It's Lonnie.
Yes, ma'am.
How you doing?
I'm great.
You've done it short and sweet today.
I was pretty shocked. I thought there would be more questions.
Oh.
Sydney, have you stopped recording?